America is in the grips of a worsening shortage of healthcare workers. It's now forcing the U.S. military to rethink how it provides care to enlisted members and their families. There's a report from McKinsey Consulting estimates that the U.S. could have a shortage of between 250 to 400,000 nurses by 2025, adding that the nation would have to more than double the number of new graduates entering and staying in the workforce every year for the next 3 years just to close that gap. Joining me right now is Dr. Jerome Adams. He served as U.S. Surgeon General under the Trump administration. Dr. Adams, thank you for being with us.
Glad to be with you.
You know, the nation facing that huge shortage of nurses, how does it affect the military? Are these Army medics who work at bases serving military families?
Well, it significantly affects the military and our ability to keep our country safe. It ranges from an inability for people who are on remote bases to get care like mammograms and basic procedures to people who are retirees who still get their care on military bases. But I've talked to many people within the military about this issue, and they've really focused on making sure our active duty folks are prioritized. I think what you're going to see is a spillover impact more so on families and on retirees.
So the new director of the Defense Health Agency, which delivers health care to 9 million U.S. service members, saying the shortage will force the military to rethink its entire healthcare system. What changes do you think need to be made?
Well, one of the things that came out of the pandemic is an increase in acceptance of and availability of telehealth. We saw a 7,000% increase in telehealth out of the pandemic, according to one study. And we need to leverage this technology in order to increase access to care for people who are in remote locations or even people who are in urban areas who might not easily be able to get in to see a doctor. That's one example. But another thing the military is doing that I'm a big fan of is increasing team-based care, interdisciplinary care. So for instance, behavioral health has a major shortage. And at Purdue University, where I work, we train mental health nurse practitioners. So we're trying to figure out how we can leverage doctors, nurses, techs, pharmacists, an array of different providers so that we aren't relying on just one person to provide care.
You know, the report we mentioned earlier warned the country needs to double the amount of new nursing graduates entering and, more importantly, staying in the profession in order to avoid a dire staffing shortage. So how can the military help healthcare workers to actually fight burnout and address the other concerns that they have? Because we've seen with so many nurses, they feel that there aren't enough nurses per patient. They can't provide the care that they would like to.
I'm so glad you brought up the idea of burnout. This has long been an issue for healthcare providers across the board. Again, doctors, nurses, pharmacists are reporting record levels of burnout, and the pandemic only made it worse. And we know that when people are burned out, they will be more likely to retire. But just as importantly, they're just choosing to work fewer hours and fewer days. And you've also compounded that with the fact that our population is aging, and so you've got more people in need of medical care. So what are the solutions? Again, it's trying to work smarter and not harder, using telehealth, using alternative care models like providing care for people in their homes so they don't have to come into a hospital and be run through the traditional system, I think are all important. But we've also got to work on our pipeline. We've got to encourage people to pursue careers in medicine, and particularly in the military. And I was a military doctor. This is a great career path for people. It's a great way to pay off your loans. There are great scholarships for doctors and for nurses, and it's a great way to serve your country.
But really, really quickly, one question. I know that remote locations are struggling the most here. I mean, there's an article that I have from a woman at Fort Irwin, California, saying that mammograms are not available on post in this particular region. So how do we attract doctors to these kinds of locations?
Well, again, we've got to restructure our care models. You're not going to be able to attract doctors and nurses to every location. What we've got to do is be smarter about making sure we're identifying people who need those services early, and we can get them to where they need services. And final important point, one of the things that the military is doing that I'm a big fan of is leaning into lifestyle medicine so that you turn off the spigot. If you keep people healthier, you're going to see less cancer, less cardiovascular disease, less diabetes, less need for a doctor. So it really is going to take a holistic effort in order for us to be able to meet this challenge moving forward.
Dr. Adams, we appreciate you joining us. Thank you.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.